Let's now go on and think about adverse effects of immobility on the respiratory system. Now, one of the main things here is that when patients are immobile, especially if they're nursed flat, then the secretions, the mucus produced by the chest, are not coughed up, and there tends to be stasis of mucus in the chest. Now, when you get stasis of mucus, that mucus tends to become infected, therefore the patients tend to get chest infections and ultimately, if it's severe enough, pneumonia. So let's think about now the complications of immobility on the respiratory system. So we've covered the cardiovascular system, moving on to the respiratory system. And the main complications here are hypostatic pneumonia, pneumonia caused by lack of mobility, and other less severe chest infections. So these tend to occur when normal bronchial secretions accumulate. These bronchial secretions, of course, are quite normal. They're produced by the cells lining the bronchial passages and are normally wafted away by the cilia. So when normal bronchial secretions accumulate in the lungs, because people can clear their chests much better when they're upright than when they're flat. It's a very important point to remember. Don't nurse patients flat unless you've got a good reason to do so. Because if these infections are severe enough, pneumonia may result, which is infection and consolidation to make solid the lung tissue. And there's a separate video on pneumonia if you'd like some more detail on that subject. Let's think about the signs and symptoms that you may observe should there be a developing chest infection or developing hypostatic bronchopneumonia. Dyspnea and cyanosis, difficulty in breathing, and cyanosis because the lungs aren't working properly. And of course there'll be an increased temperature because there's an infection. These immobile secretions can become infected. And because there's an increase in temperature, there's an increase in metabolic rate, therefore the pulse rate would normally be increased. And very often, initially actually in pneumonia, there's a dryish, unproductive cough, but the cough later becomes productive. So let's think about how we're going to prevent respiratory complications. And the main thing is to keep your patients mobile, of course, if you can, but if you can't, keep them sitting upright. That is the main nursing intervention. Don't lie your patients down unless you have to. Keep them sitting up in bed, propped up by pillows to keep the chest up and down in a vertical position. That's the main thing. Write that in big letters. Keep your patients sitting upright unless there's a good reason not to. Let's think about other aspects of prevention of chest infections and hypostatic pneumonia in immobility. Well, it's very important to change the patient's position, at least 1 to 2 hourly. And that allows each lung to expand on inspiration and allows chest secretions to drain. Now, if I'm lying on my left side, then that side is going to be pressed against the bed, therefore it can't inflate fully because the bed's in the way. And if there's not good airflow in and out of the lung, that's going to inhibit draining of the mucus secretions. So as that, if I'm lying on this side, then gravity is going to tend to make the accumulations collect in the lobes of the lung on this side. So the best thing to do is lie me in the other position, lie your patient in the other position, so that allows that lobe to drain by gravity. But then, of course, this one will tend to fill up. So then you need to change the position back to allow that one to drain. So regular changes of your patient's position to allow full expansion and to aid draining of mucus secretions by gravity in patients that have to be immobile and have to lie fairly flat. So change position, allow each lung to expand and allow any secretions to drain. Encourage deep breathing, coughing and expectoration. So encourage your patient to spit up secretions and give them some tissues and something to spit into so they can do that without embarrassment. Chest physiotherapy by physiotherapists where appropriate. And very often what they do is they put their hands on the chest and they actually vibrate the chest to help loosen up secretions and allow them to be coughed up. Avoid cross-infection from other patients who have established respiratory infections. So you wouldn't want someone with pneumonia to cough on your immobile patient. And very importantly, maintain fluid intake. Maintain a high fluid intake to prevent mucus viscosity. Now all the time the cilia are wafting up or trying to waft up the secretions out of the respiratory tract. But if your patient's dehydrated, then that's going to tend to dry out the respiratory secretions. If they dry out, they become thicker and more viscous. Therefore, the cilia are unable to waft them as effectively. So if you keep your patients hydrated, that will keep the mucus secretions fairly thin, and your cilia will be able to waft it better. So avoid viscous secretions by well hydrated. So maintain fluid intake to prevent mucus viscosity. And of course, should any infections occur, we want to detect these fairly early, so take the patient's temperature if there's a pyrexia, consider the possibility of chest infection secondary to immobility, and treat that early with remobilising where possible, and if that is not possible, with antibiotics. So let's look at this diagram on the complications of immobility on the respiratory system. And this is to do with the position that the patient's in. Now when patients are upright, the bronchioles are more dilated, so that leaves more space in the lumen in the middle. And perhaps more importantly than that, there's less mucus. The mucus is coughed up so it doesn't accumulate and you end up with a thin mucus layer. So the combination of when the patient's upright, the airway being wider, more dilated, the mucus layer being thinner with good mobility, means you get a lot of air in and out of the lung. So in the upright position we get a wide airway, good mucus mobility, good air entry. So clearly this is desirable both in terms of the air size and getting the mucus wafted away that the patient is upright. Whereas when the patient is recumbent, then there's a reduced diameter of the bronchial tree, of the bronchial passages. There's increased amount of mucus. The movement of that mucus away is reduced, so there's a reduced lumen, and of course this means in this thicker layer of mucus, infection is more likely to occur. So very important to make sure you've got notes in your respiratory system section that talk about maintaining the patient upright unless there's a reason not to do so, for example if they're shocked or something. So keep the patient upright if possible. So that basically brings us to the end of our talk on hazards of immobility. We've considered the cardiovascular system, respiratory system, musculoskeletal system, urinary system, gastrointestinal system, metabolic changes, psychiatric and psychological factors, and care deficits. The main thing we haven't covered here are pressure areas, maintenance of pressure areas and prevention of pressure sores, which we're going to do separately. But for now, let's remember that patients should not be immobilised unless there's a reason to do so. If they are immobilised, think about the systems we've talked about, prevent the effects of immobility wherever possible, and should they occur, treat them early. But the key word I want you to leave you with is prevention. Remember, nursing is invisible. Hopefully the patients will never know that most of these complications you have learnt about in this video ever existed, because they won't have them, because you've anticipated them, accounted for them, and prevented them.